Hi.
Hi, everybody. Welcome to this episode of COVID-19 Ask Me Anything. My name is Dr. Rita Issa. I am a GP registrar in London and here to answer your questions.
And I'm Timesh. I'm a doctor, a hospital doctor, interested in the lungs. And again, we'll do our best to answer any questions you have about this horrible virus and the illness it causes. So feel free to comment.
Yeah, so you can send us your questions on YouTube. I think it's probably the best place to send them over, but also probably through the other social media platforms as well.
To summarize, last time we answered all sorts of questions which people sent through, ranging from how people might catch the virus, how to prevent catching it, but also what might happen if you get it, what treatments there might be available to you, and then about some of the public health interventions and more political interventions that have been happening as well. So though I can't personally promise to give a good answer for everybody, we'll do our best. Great, we've got one there already.
So, question to you maybe, Mesh.
Yeah, I love this kind of one. The science stuff.
Does the virus enter the blood system?
Yeah, so very rarely. There's one study that has found in a very small group, maybe 1 in 20, 1 in 30 people, viruses found in the blood. We don't really know whether that is a cause for concern in that person, whether it's a sign of more severe disease or not. But certainly in the majority of people, even with severe lung disease from COVID-19, they wouldn't have virus in their blood. So it's probably got there by accident rather than design in those that do have it. And as a result, it probably isn't transmitted through blood either. I'd say the short answer is no, really, to that one.
Great. And we've got another question from Joseph O. So the government advice says that severe asthma means you're more at risk. What counts as severe asthma? Yeah, so there are certain groups which have been sort of thought to be more at risk of both sort of catching coronavirus, and if you do get coronavirus, then your symptoms being a little bit worse. And the groups at the moment seem to be predominantly increasing age. You've got a higher likelihood of worse outcomes, and then also certain underlying conditions. And generally, those are conditions that either mean that you have a slightly weakened immune system, or respiratory conditions like asthma. And I know that recently it has been downgraded, so that if you've got asthma and maybe you're using the blue and the brown inhaler, then that's not necessarily deemed to be particularly severe asthma. And maybe, Mesh, you want to comment a bit on what might be meant by that?
Yeah, so there's no very specific definition that we use as doctors, but a general rule of thumb is if you've been admitted to hospital, especially multiple times, with different exacerbations requiring staying in hospital, not just going to A&E, but staying in, then you'd be in the more severe category, and you'd certainly have severe asthma if you've ever needed to go to ITU with it, so ever had to have a tube done to help your lungs breathe. So that would be a rough way of looking at it. I think if you're uncertain, it's worth discussing with your GP, and until you're sure, probably stay on the cautious side. The other thing to say about any kind of asthma is the advice is to keep going with your controller medications. That's really important because they're what's going to prevent your lungs from getting worse anyway, and give your lungs the best chance of fighting off a virus if you do get it. So we've got one here. Should someone with COPDs, which is a chronic lung disease, usually caused by smoking, still go for daily walks. Confused if people at high risk should still be going for daily exercise or not. Really good question, and there's a focus for the 1 to 2 million people who fit into the high risk category. There's a real focus in a lot of the political advice to make sure that that group has no extra social contact than is absolutely necessary. However, we have to weigh that up with important things that people do on a daily basis for their lung health, and I think that going on a walk is one of those. As far as I can tell, in the last week, going on runs, people are getting better and better at physical distancing, going down the street. And nowadays there aren't many cars on the road, so you could even walk in the road if you're concerned. So on balance, definitely go out and get that fresh air into those lungs. It'll be good for you, as well as some light and even more strenuous exercise will put you in good shape to fight off the virus if you do get it.
Yeah, what I would reiterate though is that the main mode of transmission was less so really breathing in particles from somebody else, and it's more so from your hands and then touching your face. So really just making sure if you are out and about, washing your hands as regularly as you can, using something like alcohol gels, or if you've got access to that. And then when you get home, first thing, just making sure that you're washing your hands for 20 seconds.
That's a really
and
good
also
point.
within that, it's of course it's good to get out and about, but there's also lots of exercises and things that can be done in the home as well, and just open up those windows and get on there.
That's true. I think try not to limit yourself to one form of exercise a day if you've got extra time. There's a good question here from Kat O'Brien. How long after having the virus does the cough last? That's variable. I'd say on average, after getting the virus, you have 5 days without any symptoms at all, though that can be shorter, 2 days, or longer, 2 weeks. But once you've started getting symptoms, cough is one of the most predominant symptoms, and it can last for anywhere between 5 days and actually much longer. Now, that doesn't mean that you have severe disease. So if it goes on over 2 weeks, you're likely to have gone through the worst of the infection and be feeling much better. So the fever would have gone after a few weeks, other than in very severe cases. And the trouble with this virus is it causes a lot of inflammation. That's kind of immune response to the virus in the lungs, and that can take a long time to heal. So we actually say up to 6 to 8 weeks, a cough from a virus like this would be seen as normal and not need any further investigation unless you actually started feeling worse again a second time.
Yeah, and what I would reiterate with that as well is the guidance at the moment is if you've got a cough or a fever, then you're self-isolating, and that means not going out for your walks, or not leaving the house, not going to work for 7 days. If you have a fever for longer than 7 days, then you should stay at home. But if your cough persists for longer than 7 days, technically you're still at the end of your self-isolation period, because often the cough after 7 days will be because of that residual sort of inflammation in the lungs, instead of you continuing to be infectious. So you're not really likely to be continuing to pass it on to others, even though you might still be coughing.
Yeah, for sure.
Yeah. Question from Jinky. Is it true that men are more susceptible than women?
So that seems to be the case. But I think it's more to do with susceptible to severe infection. So you're probably just as likely to get it. But as a man, if you do get it, you're more likely to get severely unwell. That doesn't mean that all men will get severely unwell. The vast majority of men and women will clear it without needing to go to hospital. But why might that be, that when you look at the people with COVID-19 in intensive care, for example, those unlucky few, the majority are men? It might not be their gender at all, or biological sex. It might actually be the risk factors that are associated with it. So men's lung and heart health tends to be worse than women's for complex reasons, including higher rates of overweight and obesity, for example. So it's a bit hard to tell, but there does seem to be a significant difference, and we don't know for sure, but it might be through other factors rather than your biological sex itself.
Yeah. Question from Supermarket. Is washing shopping packaging when you get home over the top? So that's a good question. The virus can exist on surfaces for variable periods of time, depending on the type of surface that it's on. So there was an analysis that's shown, I've just got the information here. So it can remain in the air for up to 3 hours, on copper for 4 hours, cardboard 24 hours, and plastic and stainless steel up to 72 hours. So I don't think it's completely over the top to be washing packaging, but actually I would say that the main thing, to reiterate, I'm going to be known as the hand washing person, is washing your hands, because it's fine if you touch the packaging and it gets onto your hands, that is not going to pass through the skin. It's only if you then touch your mouth or your face. So making sure that you're washing your hands first and foremost, but I wouldn't say it's completely overkill to wash your packaging. You don't necessarily.
It's really hard one, and there's always a risk everywhere, in the sense that anyone could have touched anything anytime. But think about the gradient of risk and how likely it is, and also bear in mind virus is dying as soon as it starts touching the surface. It's slowly dying. The number of viruses that are surviving will go down and down and down till about 2 days, when there'll be none left. But before the 2 days is up, there'll be very few, and your risk will be low. So there's only so far you can go. Great. So what do you think explains Germany's comparatively low death rate? This is from FB. That's a really good question, actually. And I think the main explanation.
I was just going to say, my mum called me up to ask me this morning.
I would be asking it if I hadn't already read it, for sure. It's a trick of epidemiology. So by that I mean studying health of populations. In reality, we're not comparing the same thing, and that's because Germany is so good at testing, right? So it's testing a lot of people who are mildly symptomatic, where they wouldn't get a test in the UK, or even not symptomatic at all, and just testing people because they're contacts of others with the infection. And so the number of people they're testing with mild disease is higher. That means that the proportion that go on to get severe disease or even die is much lower. There are probably other factors, and we don't know. As a result of that quirk of stats, we don't actually know how much it's to do with how good the treatment is in Germany, or whether the virus has mutated. But the most likely explanation, I'd say, I don't know what you think, Rita, is to do with the denominator being different.
I mean, I do definitely agree with that. If we were testing everybody in the UK who's who possibly has the virus and is displaying symptoms, then proportionally our death rate would be lower. But actually, a question to you, Mesh, which I don't really understand also, is that Germany's absolute death rate is lower as well. So I think they've had a couple of hundred deaths.
And that might be because they're
more than that.
It might be because they're earlier on in the outbreak. So can't really know for sure, and we'll sadly only know for sure with time for that one, which is depressing to think about.
Okay, next question over here from Daniel Eden. Is a wet phlegmy cough a sign you have not had the virus? So what I've increasingly found with this virus, and actually also thinking that I've had it too, is that there are many different types of symptoms that are associated with coronavirus, and increasingly we're finding more and more symptoms being associated with coronavirus. And part of the difficulty with really identifying what symptoms are associated is the fact that we're not testing everybody who has, possibly mild symptoms. So there's been some increasing evidence, and I'm sure that you've read in the news that certain symptoms like anosmia, so losing your sense of smell or losing your sense of taste or having an alteration in that, could be associated with coronavirus. In some places, that's been up to 2/3 of cases have been associated with that. And also we're seeing that in addition to fever and cough, some people are displaying fewer symptoms, so not getting a fever, or even though fever is the most common symptom, or not necessarily getting a dry cough, or some people who are getting the cough are getting a wet or phlegmy cough. And then other symptoms too, so things like headaches, muscle aches. Some people have noticed diarrhea as a symptom or change in bowel habits. So I wouldn't completely rule it out and say, okay, it's not a dry cough, it's a wet cough, so it's not coronavirus.
No,
it might be a slight jump away from it. But...
In the 1,000 cases that were reported in China, in New England Journal, a third had a productive wet cough, 2/3 had a dry cough. Some of those had both at different times, and small number had no cough. So that gives you an idea. It's not an exclusion at all, really. Cheers, Rita. So when is the likely peak of infection given UK's current lockdown advice? That's a tricky one. So this is all predictions based on models, really, isn't it? And I think the predictions I've heard range from within 2 weeks to 6 to 8 weeks, really. The difficulty is that might be the peak of infection, but might not be the peak of death. We don't know for sure, but at the moment we're going through a very rapid increase in the number of deaths, and that will be what remains the most shocking aspect of this on a national and international level. And so even if the infection starts to slow in its spread, we're going to be stuck with the consequences of people who are maybe even already infected now getting sicker and sicker.
Yeah. We've got lots of questions coming through. This is really great.
Hey.
From Marco, what is the situation like in your and your colleagues' place of work? So I'm a GP registrar, which means I work usually in a GP practice. Actually, my job is split half GP and then half academic, so like at a university. And so all academic clinical people have been asked to basically step away from their research time and go full-time into clinical. And I've got lots of friends who are, for example, public health doctors, so they've not worked with patients for a really long time, and they're being pulled back in if they can to come and work in clinical settings. So I guess firstly, we're seeing a huge number of people entering the workforce very rapidly. Also, final year medical students have just been really rapidly passed through their last year, so they'll be joining the workforce in the next week or two. At the GP practice, predominantly, we have shifted from face-to-face interviews. You might have noticed this at your own GP practice. So, face-to-face consultations to, where we can, telephone consultations and online consultations. And what's been quite interesting is that's something that we've sort of been trying to do anyway in GP, and it's really fast-tracked that process. I think what we imagine will happen over the coming weeks is that as hospital capacity moves to responding to COVID and things like outpatient appointments get cancelled, general practice is going to be picking up a lot of other hospital work where the capacity within hospital has changed. Both of us have got lots of friends who work in hospital. I'm going to be also going back to work in hospital at some point soon. And they are like, the whole layout and organization of the hospital has changed. So there will be COVID or like infected wards and then like clean wards. And there's an attempt to keep those two areas separate, but obviously there are going to be people who are presenting to hospital with perhaps unusual or slightly different symptoms who do have coronavirus and who end up going on a clean ward. I know that various hospitals have brought in different shift patterns, so changing from like a standard sort of pattern of working to like 3 like 12-hour shifts on, like 2 off, and then rotating like that. And that's just to try and maintain the workforce, because obviously with the virus going around, and then also with various isolation rules and stuff, people are having to take time off. So we're seeing, yeah, just like massive shift in workforce as well.
Well, there's no such thing as a weekend now.
Yeah, bank holidays don't exist anymore.
Sadly. Yeah, really well described, Rita. And I'm a lung training doctor, but also a researcher like Rita. And I'm about to go back into the hospital next week. And I think it's really important to say that general practice and community healthcare is going to be really important in the next month or two. It's only so long that people without coronavirus, but with other conditions, stay away from hospital, which is what we've seen in the short term. That's going to be essential to work as a whole system and to deburden the hospitals. So everyone in the healthcare system has a role to play in this. Yeah, is there anything else you'd want to add?
I think that's that. I mean, it's just unfolding and it's changing so rapidly. So every day that I talk to colleagues and things, the whole situation is shifting.
So Matthew Carter's asked divisive but important question. Why are World Health experts suggesting isolating for 14 days versus UK saying 7 days? I think that's a really good question. And I don't know which is the right answer. The evidence there are two aspects. One is you're most infectious when you first get symptoms, and actually can be infectious before you get symptoms. And the second thing we know is your infectiousness goes down with time after you first get symptoms. There will be cases of people who are infectious for 3 weeks, probably, just knowing from the samples that you can get of virus in the lungs of some people, especially with severe disease. Equally, there are probably people who clear the virus in less than a week. I think it then becomes a public health and political decision how sure you want to be by isolating people further versus the impact it would have on their lives. And bear in mind that if someone is forced to isolate for 14 days rather than 7, they may feel less able to generally physical distance for as long, and it could be going on for a few months. So you have to be a bit pragmatic about this, and different countries have chosen differently. And it's obviously less cautious to isolate for 7 rather than 14 days.
I guess just to clarify also on that, because I think there's been a lot of confusion between the 14 days of isolation if somebody else has got symptoms in your household.
Oh yeah.
And essentially, just to clarify on that, so if you've been exposed to the virus, you can start to show symptoms from anything from 2 days after to 14 days after, actually some people longer, but basically what they're banking on is the fact that, okay, you've possibly been exposed to this thing, and you need to give your body the chance to start showing symptoms. And then when you start to show symptoms of cough or fever, then you self-isolate for 7 days. So even if you're at the end of that 14-day period and then you start to show symptoms, you then self-isolate for those 7 days. I've actually, for myself, having had some viral symptoms, even though they weren't technically like this continuous dry cough or technically a measured temperature, I didn't have to I decided to self-isolate anyway, just because I know that there are, especially if you're younger, there are like other symptoms that you can get with coronavirus, and I just really didn't want to run the risk of going into work and passing it on to my colleagues and their families and whatever else. So I would generally, at this time, Mesh knows, like, I will work through anything usually, but at this time I am trying to be extra cautious, and I sort of invite others to do the same as well.
Great, yeah. So I suppose at this point, for anyone that's joined, I'm Timesh. I'm with Rita, with two doctors answering your questions about coronavirus. Literally ask us anything. I've noticed Rita's just been asked out on the question list, so that's quite funny. But we're going to try and carry on answering all of them, because these are all really important questions, making me think, and clearly, like, the level of understanding has shot up amongst the public, and understandably, right? But I think if there's any positives to draw from this, it's a scientific literacy. So that's great. One question: should we wear a mask? So masks are used in different situations. Different masks are good in different situations. Healthcare workers are highest risk of being exposed to virus either through direct cough or through aerosolizing procedures, such as putting a tube down someone's throat for when they need to be helped to breathe, or doing other procedures around the mouth, and as a result, that's the setting where masks are most useful. If you have a cough yourself and you're worried about spreading it to someone else, it's also a clever time to use a mask if you can get hold of one. However, if you don't, and you're walking outside, you're probably at no increased risk without a mask. The reason I say that is actually even the WHO has now acknowledged that this virus can't be spread through the air in normal conditions, really. It can only be spread through the air, i.e. breathing in the air of someone who has passed you in the street. It can only really, it can't ever in the street, and it can only really happen if something abnormal is happening to your airway to push the virus into the air. So like I said, the things that happen in hospital. A cough will send a droplet, sometimes microscopic, through the air, but still too heavy to remain in the air. That droplet of mucus that has a bit of virus in it will fall down within 2 meters of you, and that's why the 2 meter physical distance has been recommended. The main way it would then get into you is not directly through being breathed in, of course. It's through you touching a surface and then you touching your face or eyes. One benefit of a mask is it will stop you touching your mouth, nose, or eyes, but really washing your hands is like 95% of the way there. And actually, wearing a mask, if not done properly, can make you touch your face more at the time unless you wash your hands. So, and they're in short supply. That's my take on it, I'd say.
Yeah, so I would say only really, like in the community, only really if you've got a bad cough and you don't want to pass it on to others, but still, I would generally tend away from it. Actually, also, today, peering out of my window, saw some people wearing gloves out and about, and I thought that was quite interesting. And I was just like reflecting on it, because we do wear gloves in hospital, but usually change gloves between every person that we see, and so essentially, and we all wash our hands. But actually, if you're wearing the same pair of gloves and you're out and about, then the virus can still get onto the gloves, and then you can still transfer it to you. So the gloves, I don't really know necessarily what they add, apart from maybe if you're wearing gloves, it'll make you think more about not touching your face. But I just don't really think that they add very much.
Yeah, good point.
All right. The next question. Do young health workers end up in ICU because they're exposed to a higher viral load? What does this mean?
I think, yeah.
So the theory is that if you're exposed to a small amount of virus, say in passing on the street or something, in the way that Mesh just described, then if it's a small amount of virus, then your body is able to sort of mount an immune response, is what it's called. So like the fighter cells in your body are able to respond to that small amount of virus, and then you can build up the ability to respond to it in a way that doesn't overwhelm you. Is that an okay description there?
Yeah.
But if you're in hospital and you're being exposed to lots and lots of virus, then it can be a bit more overwhelming. Does that make sense? Something
Yeah, and I think the other thing is in hospital, you might have one big moment of a big exposure. That's the other thing. It's not just like necessarily collecting it in everywhere you go. You might just get, millions of virus in one droplet, for example, the wrong moment with the wrong setup in an urgent situation, ending up on your mucous membranes and then being very hard for your initial immune response to get hold of. So, yes, one more question here. I mean, these are really great. Do you think that COVID-19 has been in the country a lot longer than the official stats say? Well, I think we can really know. We can know when it came. The reason I say that is it's a short-lived, relatively, infection. It can go on for up to 3 weeks, but it's not likely, in fact, it's impossible for it to have laid dormant for months in people before suddenly causing severe disease and death. It causes quite a specific finding on X-ray and CT scans, which means we probably haven't been missing it. And especially given there was an outbreak in China, and that's very well documented, and now we're able to find the very same virus in people here makes us certain that it arrived in January and February, not before that. However, of course, the number of infections we've diagnosed only represents people that were infected, say, on average a week to 2 weeks before that. And we're not picking up people in the community who are infected. And then if you take deaths, that's another 2 weeks potentially down the line. So the data is lagging, but it's lagging in a way that we can very easily extrapolate from backwards in time.
Great, thank you. We have a question about soap.
Yeah, maybe.
I can't find hand wash in shops. Do you know if shampoo/shower gel with sodium lauryl sulfate is a reasonable alternative? Short answer, yes. So soap or alcohol is able to basically break down the viral envelope, the things surrounding the virus. And, so soap is fine. Actually, even soap without SS is probably fine.
Yeah, I agree. Oh, we've both frozen for me on my screen, but I can still hear you, so I'm going to crack on. Might just be my issue.
The question, Timesh, you seem to have the sniffles. Should you be self-isolating?
It's funny you say that. I am. In fact, I'm day 6 of relatively mild symptoms that weren't very typical for coronavirus. So I'm probably don't have it. More like blocked nose and snotty, bit of sore throat. I'd probably leave the details at that. But the point is that as of tomorrow, maybe Monday morning, I've reached 7 days, and I doubt it was anyway. But thank you for your caring question. Great.
What have we got next? Maybe this might be our last question. Actually,
yeah, we've got less than 10 minutes, haven't we? So let's just to warn everyone. Yeah, should we crack on with a few more? I still can't see either of us, but
okay.
So you lead.
Well, we can see you.
Okay.
Yeah, and apologies about the quality today. I think lots of people are on the internet now. And unfortunately, my webcam.
I'm back.
Using my phone. Anyway, question. Are we heading for a much stricter lockdown? What do you think? I mean, today actually Spain has just announced that all but key workers are on lockdown in their homes, but also Spain has seen a real rapid sort of rise in cases and death rates.
I think so. Speaking to a civil servant friend of mine who shall remain nameless, and it sounds like their strategy is going to be to keep it as it is unless there is a public call for more strict measures. Now, that might happen as deaths increase, because obviously it's a shocking thing for many people's families to go through, and they'll want more action. So that's one person's perspective. Someone else I heard saying, actually sending a WhatsApp round saying that they're about to go into full lockdown. I maybe take that with a pinch of salt. But really, no idea. I'm just going on what other people have told me.
Yeah.
We missed the question, actually. What are the most effective steps to prevent household transmission?
Yeah. So the most effective would essentially be isolation within the home, using a separate bathroom, not utilising the same utensils, and essentially living as if you were completely isolated. And I do recognise that that's really, really challenging for households. But I also do have friends and colleagues who are health professionals where different family members are essentially living in different rooms because the health professional who's going to work isn't wanting to come back and sort of transmit. And so, you know, their partner is like leaving them food in the room, and they just come home, wash off all their clothes, go to their room, and then just don't see anybody. But I'm going to bring it back to hand washing, just making sure that surfaces are clean, washing down like surfaces that you might be touching, door handles, really trying to limit the amount of time that you do spend together, and especially in those first few days of being symptomatic as well. What would you add, Nash?
Yeah, no, for sure. There's only so much you can do, but yeah, it makes logical sense. Just think about how the virus spreads through droplets and on surfaces, and try and take it from there. Things like someone can deliver food to the person who's isolating, but they probably shouldn't deliver the dirty plate back for that person to go and wash for them. They should go and wash it themselves.
Yeah.
And ideally in a different sink, but you know, probably no one could do that. So then, you know, making sure that as the infected person, you wash your hands before going into the shared environment, wash your own things with soap, wash your hands afterwards, etc. Yeah, so what's
So
here?
we've got two final questions, which actually are sort of related, so maybe I'll just read them both out and then
Great.
we'll see if you can answer them. So the first from Raf Wortman, which is, what's the chance this becomes a yearly or regular occurrence? And then the second from Savouring Seasons, do you think we could return to normal life over the summer and then the virus return and we go through this again?
They're really good questions. Could it become a yearly occurrence? Quite possibly, but given this is a novel pathogen for most of the world's population, the most similar other one being what caused SARS in 2003.
What do you mean by novel pathogen?
Sorry, new bug.
Yeah.
Thank you, Rita. The lack of immune protection amongst most people in the world is high this time round. But every time this virus mutates again to do another round, it will come across a slightly more immune population. So individuals who've been infected this time and survived, the vast majority who get infected, will get less severe disease next time, probably because the virus is quite similar, has only mutated a little bit. The event that was the most dangerous was that moment when it came into humans for the first time, probably from an animal reservoir where it had been mutating away, getting very different to other human viruses. The moment it comes across it's a fresh new thing. Whereas, like I said, repeat rounds will be less severe.
Yeah, and that would hopefully also be limited or somewhat assisted by the development of a vaccine. And we've become okay at being able with the flu virus, for example, to predict what strains are going to be out there in the winter. So we develop a vaccine that's for that particular type of flu virus, and then people who are especially at risk will get the yeah.
And related to that, the other question, I think there is one scenario that could happen, which is after 2 months or so, maybe even less, we have a bit of a summer, and then a few months later go into lockdown again. I could imagine that could be a scenario, because we're trying to really spread the peak out, and that means preventing anyone who hasn't been infected being infected. As soon as we come back into contact with each other, the chances are another wave of infections will happen. That's just, I think that's a political decision about trying to manage how people isolate and for how long, and the political will to do that versus restart the economy. I could imagine a scenario where we have a few shutdowns in the next 12 months to stagger it out, but I don't know.
Yeah. Great. So I think on that note, on that unfortunate note, that's actually all we've got time for today. But thanks so much for joining us on this Saturday night in isolation.
Is there anything positive we can say?
Yeah, I really just hope that actually, even though at this time we, we might be physically isolated from the people around us, yeah, I've just been heartened by just the social connections that are being forged, the like rapid and pretty like far reaching sort of political change, and in certain ways actually seeing that that change is possible, and it's possible in a much more rapid way than we ever thought it could be. Everything from like housing rough sleepers to being able to properly fund the NHS to ensuring that disabled people are able to work at home, like all of these different things which just seemed so impossible before and now very tangible. And I think it's something for like our communities and like the community that's around Novara and all of these spaces to really try and make the case and ensure that that these changes remain afterwards, because I think that there's going to be a pullback. There will be the attempt to go back to where we were, and that's not.
Yeah, there's an opportunity through the rubble. I just realised it might have been Mo, a friend of mine, that commented about my sniffles, so that's very kind of him. If it is, say Mo. Great, yeah. Thanks for wrapping it up with that, Rita. It's important to think of the bigger picture and what we can take from it. But great, thanks for all the questions.
Yeah, thanks to Novara for having us as well.
Yeah, cheers, guys. Talking about washing hands is maybe slightly less analytical than their usual sharp comments, but we're playing a different role. But thanks a lot to the host.
Bye.